Come in. Hi,
Hi,
my name is Emily, and I'm going to be your student nurse today performing your physical assessment. Can you state your name and your date of birth for me?
Whitney, 7/22/2000.
Great, and how old does that make you?
19.
Awesome. What gender do you identify with?
Female.
Okay, good. Does anything bring you in today? Any pain, any discomfort?
No.
Okay, so if you were to rate your pain on a scale of 0 to 10, 0 being no pain at all, and 10 being the worst pain of your life, what would you rate it?
0.
All right. So you're in no apparent pain. What are you doing nowadays? Are you a student? Do you work?
Yeah, I'm a student.
Okay. Where do you go to school?
Colby Sawyer.
What do you study?
Nursing.
Is that stressful?
Yeah.
Are you handling your stress okay?
Yes.
Okay, good. So do you live on campus or do you live off campus?
I'm on campus.
So does that mean you eat at the dining hall or
It
do
does.
you? Okay.
Dining hall.
Do you eat 3 meals a day?
Mhm.
Are they pretty balanced?
Yes.
Okay, good. Do you exercise regularly?
Yeah, about 2 times a week.
Okay, good. You appear to be in good physical health. Your posture is looking good. Your mood and affect appear to match each other. Your mobility as you were walking in looked good. Based on our conversation, your speech and your hearing is all within normal limits. Can you state the date and where you are for me?
December 10th, 2019, we're at Colby Sawyer.
Great. You appear alert and oriented as well, and your personal hygiene is looking good too. So everything is looking good overall. So I'm just going to jump right into your physical assessment, just starting with your arms. Any pain or discomfort as I'm
No.
feeling? Okay, so there's no apparent lesions, lumps, bumps, anything like that. No deformities. Your skin is warm, pink, and dry. Your texture appears to be just fine. There's no excess moisture, and so everything is looking good. I'm just going to test your turgor. Great. Turgor is within normal limits on both sides. It is clear that you are hydrated. And your cap refill is less than 3 seconds on both hands. So everything is looking good there. So now I'm just going to move on to your scalp. I'm going to feel around. Let me know if you feel any tenderness or pain or anything like that. Good. Your cranium appears to be intact. Your hair is clean. Did you feel any tenderness or pain as I was feeling around?
No.
Have you experienced any headaches lately?
No.
Okay, good. So your cranium looks good. There's no apparent lesions, deformities, lumps, or bumps. So everything is looking good there. Can I have you smile and frown and puff your cheeks and close your eyes and don't let me open? Great. Cranial nerve 7 appears to be intact. Overall, looking at your face appears to be symmetric, so that is good. And I'm just going to take a quick feel for your ears. Your skin is warm, pink, and dry. Is there any tenderness or pain as I'm feeling?
No.
Any trouble hearing lately?
No.
Okay, good. So there's no apparent lesions, lumps, bumps, or deformities on your ears, so everything is looking good there. I'm going to have you look straight at me, and I'm going to rub my fingers together, and when you can hear my fingers, please say now, okay?
No. No.
Great. Cranial nerve 8 appears to be intact. You can hear within 2 feet of you, so that is all normal. So that is looking good. And now I'm just going to take a quick look at your eyes. I'm going to have you cover one of your eyes with your hand, and I'm going to have you tell me when you can see my finger in your peripheral view. Okay?
No. No. No.
Okay. And on the other side?
No. No. No.
Great. Cranial nerve 2 appears to be intact. And now I'm going to have you look straight at my ear. I'm going to flash a bright light in your eye, so please do not directly look at it, okay? Great. Cranial nerve 3 appears to be intact. Your pupils are constricting as they should. And then one last one. I'm going to have you look straight at me, and I'm going to move my finger. So please follow my finger with your eyes and do not move your head, okay?
Mm-hmm.
Great. Cranial nerve 4 and 6 appear to be intact. So you've had no issues with your vision lately? No blurriness? No nothing?
No.
Okay, good. I love to hear it. So that's good. Now I'm going to have you occlude one of your nostrils, and I'm going to put a scent underneath it, and I'm going to ask you to recognize it and tell me when you can smell it, okay?
Mm-hmm.
So close your eyes.
No. No.
Can you recognize that scent?
Alcohol.
Great. So cranial nerve 1 appears to be intact. So now I'm just going to move down to your mouth, Your lips appear to be pink and symmetric. I'm just going to wash my hands and put on my gloves. Do you go to the dentist regularly?
Yeah, about 1 to 2 times a year.
Okay. Do you brush your teeth regularly?
Mm-hmm.
All good things. So I'm just going to grab my tongue compressor and the light. I'm just going to take a look and say, ah. Great. Your uvula is midline. Your tonsils move medially, and your soft palate rises as it should, concluding that cranial nerve 9 is intact. Your buccal mucosa is pink, shiny, and has no apparent deformities or lesions on it. Can I have you lift up your tongue? Great. Your tongue is shiny with veins on the bottom. I'm just going to take a closer look at your cheeks. Perfect. So everything is looking good. Your teeth appear to be healthy, and your gums as well. So everything is looking good in your mouth. I'm just going to throw this away. Okay. So everything is good. Can I have you swallow for me? Great. Based on how you're handling your secretions, I can tell your gag reflex is intact, meaning that cranial nerve 10 is intact and within normal limits. So that is good. So now I'm just going, excuse me. I'm just going to move on to your chin right here. Can I have you clench? And move your jaw side to side and open and close. Great. And push against my resistance. And then don't let me open. Great. So cranial nerve, the motor portion of cranial nerve 5 appears to be intact. And now I'm just going to move down to your neck. Is there any tenderness or pain as I'm feeling?
No.
Any neck pain lately?
No.
Okay, good. So there's no bumps, lumps, lesions, or deformities that are apparent on your neck. So everything is looking good there. Your trachea appears to be midline, so that's good. So yeah, overall your neck is warm, pink, and dry, so everything is good. And I'm gonna just have you turn your head against my resistance. Great, and on this side. Great, and raise up against my resistance. And move your head to the left, and to the right, and up, and down, and around in a circle. Okay, very good. So cranial nerve 11 appears to be intact and well. I'm just going to take a feel for your carotid pulse. Present and full on that side, and present and full on that side. So I'm going to take a quick listen. I'm just going to clean my stethoscope first. Every time you feel my stethoscope on your neck, I'm going to ask you to hold your breath so I can listen to your carotid pulse. And if you get lightheaded or dizzy at any point, please let me know and we can stop. Great. And take a breather. Great. Your pulse is steady and equal on both sides. Your rhythm appears to be regular, so everything is looking good. So now I'm just going to have you turn around for me. And I'm just going to feel your back. Is there any pain or tenderness as I'm feeling around?
No.
There's no lumps, bumps, lesions, or deformities that are apparent, no palpable thrills or visible pulsations that are visible. So everything is looking good there. And so I am just going to have you take a deep breath in and out. Great. Your chest expansion appears to be equal and even on both sides. Your chest is symmetric and your thoracic cage appears to be even. So that is all good. So I am just going to place my hand on your back, and every time you feel it, can you say 99 for me?
99, 99, 99, 99, 99, 99, 99, 99.
Great. I was just testing for tactile firmness, and your vibrations are palpable and equal on both sides. So that is good. So now I am just going to percuss your lung fields. Thank you. So everything is looking good there, nothing out of the norm. So that is good. And now I'm going to take a listen for your breath sounds. If you every time you feel my stethoscope, please take a deep breath in and out. If you experience any lightheadedness or dizziness, please let me know and we can stop. Great, your breath sounds sound clear and equal on both sides. So everything is looking great. Can I have you turn around for me? I'm just going to do the same thing on the front. I'm just feeling around any pain or tenderness as I'm feeling?
No.
Okay, good. So everything is looking good. There's no lesions, lumps, bumps, palpable thrills, or visible pulsations in your chest. So everything is looking good. There's no pain or tenderness. So I'm just going to take a look. I'll listen for your breath sounds. Same thing. Every time you feel my stethoscope, please just take a deep breath in and out. And if you experience any lightheadedness or dizziness, please let me know and we can stop. Great. Breath sounds appear to be clear and equal on both sides. And your respirations appear to be unlabored and regular, so that is all good as well. So I'm just going to have you stick out your tongue for me, and to the left, and to the right, and say light, tight, dynamite.
Light, tight, dynamite.
Great. Cranial nerve 12 is intact, so everything is good there. And so now I'm going to have you stand up with me, and I'm going to ask you to raise your arms up, and back, and over your head, and behind your back, and behind your head. And I'm going to have you lift up against my resistance. Great, that was testing muscle strength of the shoulders and range of motion of the shoulders. And now I'm going to ask you to flex and push against my resistance and extend and push against my resistance. Great, and then I'm going to have you pronate and supinate. Great, so that was testing the range of motion of your elbows and as well as the muscle strength. So now I'm just going to do your wrist and down and up and down and up and out, and a fist, and touch each finger to your thumb. Great, and then inwards and outwards. So that was testing the range of motion of your hands, and now I'm just going to, your hands and your wrists, and now I'm just going to test it for muscle strength. Can you pull against my resistance? Perfect, and pull against my resistance. Great, everything is looking good there. I'm going to ask you to sit back down and lay down, please. Okay, so I'm just going to take a look at your heart. I'm just feeling around in the pericardium, no palpable thrills or visible pulsations, no lumps, bumps, lesions, or deformities, so everything is looking good. I'm just going to take a quick feel for your apical pulse at the 5th intercostal space, mid-clavicular line. Great, it is palpable and full, so everything is within normal limits there. And then I'm just going to take a quick listen to your heart, starting at your aortic valve, to your pulmonic valve, and then the tricuspid valve, and then the mitral valve. Great. I just took a listen to your apical pulse for a whole minute. Your rate is within normal range. It is 62 beats per minute. It was steady and full and present the entire time, so that was good. So now I'm just going to have you, you are at a 45-degree angle, and I'm just going to have you turn your head that way. There are no visible pulsations, lesions, lumps, bumps, or deformities in your neck, and there's no apparent jugular venous dissension. And on this side, please. Same on this side. There's no visible palpation, in lesions, lumps, bumps, or pulsations in your neck, and there's no obvious jugular venous distension, so that is all good. Now I'm just going to move down to your abdomen. Upon first glance, you're looking good. You appear to be symmetric and equal on both sides. And now I'm just going to take a quick listen to your bowel sounds. Can I ask you to move your pants to your waist level? Thank you. Starting in the right lower quadrant. Into the right upper quadrant. And the left upper quadrant. And the left lower quadrant. Great, your bowel sounds appear to be active and within normal limits. So now I'm just going to take a listen to your vascular sounds. Great, vascular sounds appear to be within normal limits as well. So now just taking a look, I'm just going to feel around. Your skin is warm, pink, and dry. There's no obvious lumps, bumps, lesions, or deformities. Your umbilicus is midline, so that is looking good. And now I am just going to do a light percussion in each quadrant. Great, so everything sounds within normal limits there. And now I'm going to do a light palpation. If you experience any pain or tenderness at all, please let me know, okay? Any pain or tenderness?
No.
Okay, and now a deeper palpation. Any pain or tenderness?
No.
There appears to be no swollen organs, anything like that, so everything is looking good in your stomach. So, like your stomach, your chest is warm, pink, and dry, just like your abdomen is. So I'm just going to move down to your legs and your lower extremities. So your skin is warm, pink, and dry. Your legs appear to be symmetric on both sides, so that is looking good. There is no apparent pretibial edema, so that is all good things. And now I'm just going to take a feel for your posterior tibialis pulse on both sides. Great, they are palpable bilaterally, and they are full and present. And I'm just going to take a look at your dorsalis pedis. Great, they are full and present bilaterally and both palpable. So I'm just going to ask you to scrunch your toes and extend your toes. Great, your toes look to be just fine. There's no apparent lesions, lumps, bumps, deformities, or ulcerations, nothing like that. So those are looking good. So now I'm just going to test the range of motions of your hips and your knees. So I'm going to ask you to move that leg outwards and inwards, and this leg outwards and inwards. Great, everything is looking good there. Now I'm going to ask you to raise your leg all the way up without bending your knee. And on this side, please. Great. And now I'm going to ask you to bend your knee all the way to your chest. And on the other side. And now I'm going to ask you to plant your foot on the bed and turn your knee inwards and outwards. And this leg too, please. Inwards and outwards. Awesome. So everything is looking good in your hips and your knees. So now I'm just going to ask you to bend your knees over the bed. Just taking a closer look at your knees, they still appear to be symmetric, and even the lumps, bumps, lesions, or deformities that are present. Any knee pain lately?
No.
So I'm just going to ask you to bend your feet downwards and push against my resistance. Great. And bend your feet up and push against my resistance. Great. And then point your toes inwards and outwards. So your ankles are looking good. Muscle strength is looking good as well. I'm just going to wash my hands real quick after touching your feet. So now I am going to ask you to tell me when you can feel my touch. I'm just going to ask you to close your eyes as I'm doing so, okay?
Mhm.
Close your eyes.
Now, 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 now.
Great. Sensory portion of cranial nerve 5 appears to be intact and well. So now I'm just going to move on to this. I'm going to touch you in different places in your body. It is either going to feel soft or sharp, and that's what those feel like, okay? So can I ask you to close your eyes, please, and let me know if it feels sharp or soft?
Sharp, soft, 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 sharp, soft or sharp,
Mhm.
soft, soft, sharp,
Mhm.
sharp, soft, soft.
Great. So everything is looking good. That was just testing your cerebral function. And this is also going to be testing your cerebral function. I'm going to have you touch my finger and then your nose, okay? Great. So everything is looking good there. And now I'm just going to ask you to stand up. And I'm going to ask you to take a few normal steps for me from here to there. Great. And then I'm going to ask you to do heel to toe, heel to toe. Once again, your gait and mobility appear to be within normal limits, so that is all good. And now I'm going to ask you to stand on one leg. And I'm going to push again. Don't let me push you down. I was just testing for muscle strength in your knees, and on the other side. Same thing. Perfect. And the last thing, I'm going to ask you to move your heel to all the way to your knee. Great. So that concludes our physical assessment. Do you have any questions for me?
No.
Nice meeting you, Whitney.
You too.